If you or someone you love struggles with chronic pain and depression, watch till the end of this video to learn the connection between the two. Hey, I'm Dr. Sam McDonald, brain health expert, helping you rewire your brain so you can live a better life. If you love this content, make sure to like and subscribe so you get the notifications for each week's new video. So chronic pain is classically defined as any pain syndrome that lasts longer than the healing window for the initial injury. Meaning, let's say if you sprained your ankle and it should be completely healed within 4 weeks, and you're still experiencing pain 8 weeks after that initial injury, that would be categorized as a chronic pain injury. So there can be a number of causes that can increase this whole chronic pain cascade. Things from inflammation or chemical causes in the body like inflammation, or maybe increases in uric acid that leave the crystal deposits in the different joints that can cause stiffness, pain. You can have neurological insults, meaning there could be problems with the actual nerve communication from the joint, the tissue, the spine, even up into the brain and the central nervous system. There can be those kind of causes. There can even be some correlation between emotional pain and then actually causing physical pain in the body. That's been proven as well. But when it comes to depression, there's really only a couple things I want to focus on specifically for this video. The first one I'm going to talk about is what's called frontal lobe integrity. So there's many different parts of your brain. The one I'm talking about right here is right behind your eyebrows, and that's your frontal lobe. This is responsible for your executive centers, your rational thought, and some of the more important functions of this part of the brain is it inhibits the fight or flight or sympathetic part of the nervous system, and is actually what activates the relaxation and healing part of your nervous system called the parasympathetics. Now, there's multiple studies showing that those that struggle with chronic pain issues will have dysfunctions in the autonomic nervous system, meaning that they're stuck more in a chronic fight or flight state. They actually will show that there's an increase or growth in the amygdala and insular cortexes down in the lower parts of the brain that fire into and fire up this whole fight or flight system. And there's actually shrinkage of the frontal lobes, so you have an increase in this runaway freight train and less brakes to slow it down. Now, this also is going to tie into that whole chronic pain piece, because that's going to also shut down and shrink that front part of the brain. Now, there's many different takes on depression. I'm going to focus on really the viewpoint of the person who is struggling with it, and there's both an intrinsic and extrinsic viewpoint. So intrinsic is more focused on what's happening internally. You're blaming more of yourself for everything that's going on. It's sort of a everything is my fault, it's all up to me, I'm worthless, I shouldn't be living anymore, those types of feelings. That's more of that intrinsic type of depression, and that's more associated with the right frontal lobe, or the right side of the brain. There's also extrinsic depression, and that's more left side of the brain, where it's focused on the outer things, where, hey, this is more other people's fault, it's because of my boss, or my job, or my family, or friends, or the external world, right? It's all focused on everything out there, and that's why they're depressed. Now, each of these is going to have different qualities and characteristics. Intrinsic tends to have more of that classical sadness type of depression, where it's the depressed mood state, versus the extrinsic is going to have more of the anger associated with that as well. So it may not look like the classical depression, but it's still that hopelessness feeling that's there as well. So those are two pieces that are going to be really important, is that frontal lobe integrity, because it's going to hold back that dam, or that bay of the sympathetic fight or flight nervous system that's going to fire up the chronic pain cycles. Because what happens when you get into a chronic fight or flight state is you actually get a decrease in sensation of pain, meaning that these whole pain pathways are actually easier to fire. So you're actually feeling pain more often because of this fight or flight nervous system. Now, the other piece that ties into this as well are these two neural pathways that look at pain versus suffering. So when a person is struggling in a chronic pain cycle, they're obviously firing up this whole pain pathway, but what begins to happen too is you lose this inhibitory neural pathway coming down that shuts off that pain cycle, and you start to get a firing of the what's called suffering pathway. And this is an older neural circuitry in the brain, and this suffering pathway is again going to be connected into those lower brain centers, and also going to be connected into that decreased frontal lobe function. So you can start to see how all this starts tying together, where you get a decrease in frontal lobe activity, you start to get a change in your perceptions of reality, and that suffering pathway starts to fire up, and this person gets stuck into these loops where this is never going to end. I'm never going to get out of this pain. All I can think about is how everything hurts. all the time. There's nothing I can do. I've tried everything. It's hopeless. I should just not be living anymore. You know, those types of really depressive type thoughts that come with this kind of stuff and can get really scary, especially if you're the person who's trying to take care of somebody like this. So you have all these things that are coming together that can create this perfect storm of brain problems when somebody's struggling with a chronic pain issue. So you get an issue with this particular joint, let's say it's a shoulder. What starts to happen is this shoulder hurts all the time, so somebody doesn't want to move it. When they stop moving it, that starts to send different information up to the brain called nociception versus what's called proprioception, which is movement. This nociception now starts to fire up into the brain pathways, and it starts to increase this whole chronic pain cycle. What starts to happen then is as you start to decrease the movement in this joint, you start to get less information up to the brain. Thus, you start to decrease that frontal lobe activity, because the way that this whole mechanism works is you get information coming from this joint up into the cerebellum, which is your movement centers and balance and coordination centers of the brain. That fires into the frontal lobes amongst other places, but that's going to fire into the frontal lobes. And when you're not moving it, you're not sending that information up to the frontal lobes. So you get that decrease in frontal lobe integrity. And now you start to get an increase in that fight or flight system because it can't hold that system at bay anymore. So you start to get an increase in that fight or flight system tone. So then you start to get an increase in this pain pathway even more. Over time, that's going to start to erode some of these inhibitory pathways that shut off that suffering pathway, and now this person's stuck in a downward loop. They're starting to get these depressed mood states, and all this stuff starts to come together. Okay, so what you need to do in terms of healing this chronic pain issues, you can't just focus on the joint. You also have to focus on the brain. You have to start to look at how these different neural pathways are firing and how they're working, and most importantly, you have to start to get them working again. You have to rehabilitate them much like you would a weak muscle or a weak joint. Okay, so you need to talk to a specialist, somebody who's a specialist in neurological rehabilitation, much like our office, that can help to get the brain back online, as well as get the joint working in its full ranges of motion again. So on that note, you should be healthy by choice, not by chance. For that reason, I will see you on the next video.